The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody, and welcome to Interactive Brokers live webinar event. And today, this is Andrew Wilkinson, Director of Trading Education. I'm going to hand over to my colleague in Chicago, Alison Tanarelli.
Thank you, Andrew. I'd like to welcome you all to today's presentation by Global X Funds on how disruptive technologies are enabling the reopening economy. Our presenters today are Pedro Palandrani and Andrew Little, both from Global X. My only request is I'd like you to hold the questions until the end, and we will address them if we have time or in a follow-up. So at this point, let's turn this over to our presenters and begin.
Thank you so much, Alison, and thank you, Andrew, as well, for the opportunity to be here today. And welcome, everyone, to today's presentation. As Alison said, my name is Pedro Palandrani. I'm joined today by my colleague, Andrew Little. We're research analysts covering the Thematic Investing suite of Global X ETFs. So very briefly, we are a New York-based ETF issuer with over 75 ETFs and over $22 billion in assets under management. And as you can see here, we really have a particular focus on thematic investing, which is our largest suite by assets under management. As you can see here, over $11 billion. But we also have a variety of other ETFs in the income space with MLPs, covered calls, also international access with a very robust ETF suite covering China funds and a few other areas like commodities where we're seeing a lot of interest these days. But clearly today we're going to focus on the thematic growth area, and we're really going to be identifying some potential investment opportunities in that regards. For today's agenda, we're going to hop from this intro into a discussion about how certain structural changes have essentially accelerated so far during the COVID-19 pandemic. And then we'll look to the reopening economy and discuss which themes are critical to this stage in the recovery and essentially facilitating the new norms and practices to promote safety and flexibility. So with that, I'm gonna start very briefly by talking about what is thematic investing, and then we can get into the actual meat of this presentation. So for us, thematic investing really refers to the process or the idea of identifying powerful macro level trends and the underlying companies that really stand to benefit from the materialization of that macro level trend. So as you can see here, it's really a two-step process. And by definition, these are growth-oriented strategies, right? So it's very different from other portfolio construction ideas that try to look at the past, believing that the history will repeat itself. And you know, those type of ideas really believe in mean reversion. That's not the case with thematic investing. This is a forward-looking investment strategy, and that also by definition it's unconstrained by geographic and sector definition. So it really tends to have low correlations with other growth assets or strategies. Now, we often get asked about how do we choose a theme when we launch an ETF, right? And it really comes down to a three-step process, as you can see here. Number one, we really want to have a high conviction in the theme. So we look at total addressable market, we look at expected growth rate, but at a top line and bottom line levels. We look at adoption levels, penetration rates as well, and we really want to have a high conviction in the theme. Number two, we look at the investability criteria, meaning that we need at least 20 to 25 companies to actually be able to use an ETF wrapper around that theme. And finally, we're really looking at kind of secular trends that are disrupting traditional sectors in our economy, and not in a short term. We're talking about 10 or more years where these trends are really going to play out in the long term. And as you can see here, we have a very comprehensive thematic suite of ETFs with right now 24 thematic ETFs, ranging from everything from robotics and artificial intelligence, cloud computing, genomics, and a variety of other themes, as you can see here today. We're going to be focusing on a few of those themes today. But before that, I'm going to turn it over to my colleague, Andrew, who's going to go over the current phases of kind of COVID-19 and where we are today in the stay-at-home economy. So, Andrew.
Thank you, Pedro. Appreciate that introduction. Moving into the impacts of COVID-19 on thematic investing and some of the changes we're seeing today, why we are all here today. As we're all experiencing, COVID-19 has disrupted most elements of our lives, whether it be business, our health, our consumption patterns, our interactions. It's really permeated through every aspect. The way we see it, there are 4 phases to the economy as it relates to COVID-19. There's the pre-COVID-19 economy, which is where we generally knew about the disease, but it was largely limited to China. It was unclear if it was going to reach the US borders. This was back at the beginning of 2020, end of 2019. Investors remained focused on general macro trends like the phase 1 trade deal with China pre-COVID. The stay-at-home economy is something we're all familiar with. These were the months in the spring of 2020 that much of the US and much of the world shut down. Schools, offices, stores, all closed to contain the spread of the virus. The next phase, where you see the "We Are Here" icon, the reopening economy, this is where we find ourselves today. It's a delicate transition period, somewhat delicate as it's constantly changing and evolving between the stay-at-home economy and returning to the outside world. Offices, schools, stores, restaurants, all reopening, but with limited capacity and different constraints on them that are somewhat of a moving target. New rules and norms are in place, but as I mentioned, many of these policies are tentative and subject to change at any moment's notice. Hopefully, if all goes well with vaccine rollouts and general mitigation efforts, we'll soon be exiting the reopening economy and entering what we like to call the new normal. This is where schools and businesses are open, but with the established rules and practices in place for the foreseeable future, what we'll be used to, hopefully within the next year. Moving on to the next slide. Before we dig into the exact details of the reopening economy and which technological trends and trends related to people and demographics may benefit, we first want to take a look back at the stay-at-home economy and see how that unique environment had such an impact on certain themes. The stay-at-home economy focused on containing the spread of COVID-19, requiring millions and millions to stay at home. Consumers, employers, students all had to adapt to a new reality, meaning that they couldn't travel to public spaces and needed to adopt different things that allowed them to find solutions to their typical ways of life, whether that was digital education, digital consumption platforms, or work from home. Moving on to the next slide. Though many of the impacts of COVID-19 were drastic and devastating to different aspects of the economy, we found that certain technologies and themes were and still are very well positioned to benefit and drive our push toward the new normal and represent some sort of stickiness when it comes to adoption and what our future looks like in regard to them and their impacts. Adoption for many of these technologies accelerated, which we can then see by the scaling of this adoption curve, this adoption S-curve, which really shows the cumulative adoption of different things over time based off of users. Due to the pandemic, we see a scale upward here as we see the growth accelerate in the middle part of the curve, really pushing many of these technologies forward. Moving to the next slide. Perfect, thank you. We can see that cloud computing, great example of this, as we mentioned. Software sales accelerated as companies and consumers look to the internet for cloud-based software as a service solutions like video conferencing. I'm sure everyone has at some point realized or felt some Zoom fatigue. From the chart here, we can see that cloud computing revenues continue to grow sequentially and on a year-over-year basis, while the rest of the market stagnated and struggled. So some resilience there based off of that. Next, we had e-commerce sales in the US and around the world surge compared to years prior, both in terms of overall sales and in terms of penetration of overall retail sales. Really seeing shoppers turn to online platforms to buy any number of different goods, even in classically unpenetrated segments like food and beverage and grocery. Next, video game developer revenues has surged as much as 25% on a year-over-year basis midway through 2020. As both seasoned and new gamers found much needed entertainment from the virtual settings that video games and esports provided. Overall, these structural changes and their downstream impacts should really have a permanent impact on the economy moving forward. Consumer preferences have changed with a focus on digital mediums and at-home consumption. You can see that 29 retailers went bankrupt in 2020, really changing the landscape for retail purchases and also driving and demonstrating the rise of e-commerce, as we illustrated on the previous slide. And next, right now, over 10 million still remain unemployed amid distressing permanent job loss numbers as well. Due to these permanent changes, no matter where we go from here, we aren't likely to return to the pre-COVID economy or anything before that. It will be a new normal economy, and there will be meaningful differences to the time before COVID-19. So what's in store for the reopening economy? Well, we know that new norms like mask wearing and temperature taking are now fully ingrained. COVID-19 still raging on, unfortunately, though vaccine approvals and the administration of those vaccines and general inoculations mean that there is light at the end of the tunnel, albeit there being some issues right now around distribution and also adherence. On a positive note, months after months of stagnation, when it came to stimulus in Washington, we finally saw that renewed stimulus, $1.9 trillion plan, though much more is likely needed and is expected in the coming months. But at the same time, companies and people are generally more risk averse than before. Travel bans and compulsory quarantines are still in effect. We have uncertainty around school reopenings and also uncertainty around office reopenings, these things also being inherently intertwined. We really believe that the reopening economy is something that's uncertain, nonlinear, and really has an emphasis on safety and flexibility. And that this phase of the reopening economy is very focused on what it's going to take to get to the new normal and what that new normal will look like. With that, I'm going to pass it over to Pedro now to start a discussion of the investment themes that stand to benefit from this.
Thanks, Andrew. And yeah, that really sets the ground to talk about different themes that we really believe can benefit during this current phase of the COVID-19 pandemic. So today we're going to be focusing on these four themes: the cloud computing themes, Internet of Things, genomics, and telemedicine and digital health. So without further ado, I'm going to start with the cloud computing theme. And I think it has been clear at this point that it's been a phenomenal year, 2020, for cloud computing companies as we enter that work from home economy phase that Andrew talked about. You know, that's not new news anymore. And what we really want to talk about today is the relevance of cloud computing as we reopen our economies and enter that new normal phase in the next few months or quarters. But you know, as we go through these transitions, I think it's important to understand that cloud computing companies have become extremely ingrained in our way of working, in our way of studying, even allowing us to maintain social interactions, right? You know, but before we get into the meat of the cloud computing slides, we really wanted to start with the segments that we believe represent the theme as a whole and that we include in our cloud computing ETF. And these 5 segments are the software as a service segment, SaaS companies, the platform as a service segment, infrastructure as a service, data center REITs, and then the companies that build or manufacture the components that make remote connectivity possible. And without digging too deeply into these segments, I think it is clear that businesses and individuals rely on cloud infrastructure and software more than ever. In fact, almost every organization and individuals use some form of a cloud computing solution these days, but this doesn't mean that we have reached peak cloud adoption. If we look at the right side of the slide, we can see that some recent surveys show that companies plan on increasing their cloud spend and overall adoption in the near future. Actually, we have one slide to highlight that, but we really believe that this is going to strengthen even further in the future, and more so as we think about the business model of cloud computing companies. Because for us, the business model of the cloud computing companies is really the primary reason why we have seen and expect to see growth in the theme. So their business models usually are characterized by some form of a subscription base with a strong generation of recurring revenue, meaning that these companies usually charge a monthly or a quarterly or an annual subscription fee per user, which really leads to business visibility and also generate great retention rates. And at the same time, if we look at the customer standpoint, these customers tend to achieve huge return on investments as a result of ease of management, some interoperability as well, and traditionally less upfront investments in things like hardware, in things like maintenance, IT personnel and training. All of that actually goes away with the software as a service type of solution. So that's essentially the iceberg that we can see here, because companies are really saving money on all of these fronts by relying on cloud computing solutions. So, as we think about that, it's really easy for customers to get on these software platforms, but it's very hard to get out, because once you have integrated the software to your business processes, it could be even costlier to switch providers. So it's very sticky, and that's why retention rates tend to be very high. But it's also important to understand that these companies, the cloud computing companies, tend to have a lot of fixed costs, right? In fact, in recent earnings results, we have seen some leading software as a service companies growing their bottom line EPS at a greater pace than top line revenue. So that really highlights that for software as a service companies, it's very easy to get on board or to onboard new customers without having to increase their cost. So the cost structure remains almost flat. And clearly, at the onset of the pandemic, we saw a drastic uptick in interest around remote working jobs and related services, as it is evident by this chart. On the top left chart, we clearly saw a huge pickup in data usage during the first half of the year. That's actually continuing through Q3, and we're waiting for final numbers in Q4. And then the bottom left chart shows upstream data traffic growth. And as you can see, both actually showing significant growth. And all of this growth has been reflected in the companies in the cloud computing space. Andrew before showed this slide, but if we look at the chart on the right, we can see that the software as a service quarter over quarter and year over year sales growth. And we can see there that the group as a whole has continued to grow relative to the S&P 500 companies that actually during Q2 experienced a decline, both on a sequential basis, but also on an annual basis. Then in Q3, we continue to see that on an annual basis, revenue sales for companies in the S&P 500 is still declined on a year-over-year basis. On a quarterly basis, we saw a nice pickup, but cloud computing companies have been able to mitigate all of that type of kind of cyclicality that we saw in the market as a whole. But as investors, we really want to better understand what the future looks like and what we could expect around the cloud computing theme. And the new normal, as it refers to working conditions, is most likely going to be on a hybrid way, with employees working remotely more often, and certainly more meetings are likely to be held over cloud platforms. And I think we have seen already many employers offering some flexibility that didn't exist before. So if we look at what we know about the future right now, we can see that many companies have already announced that they will allow employees to continue to work remotely. We have seen that one group of companies told employees that they could work from home until the end of 2021. And here we can see 6 high-profile companies with about 300,000 employees, and that includes Google, Warner Music, Amazon's corporate office, and a few others. And then there's another group, and this is probably more impactful, that actually told employees that they could work remotely permanently. And just these 6 high-profile companies, as you can see here, have about 70,000 corporate employees. So I guess it's still a small sample size, but combined, these companies have about 400,000 employees that are expecting to continue at some degree their remote operations. And again, these are high-profile companies, but really this is happening across many industries and many companies from any kind of size that have approached the working situation in a similar fashion, and we would expect to see in the future a hybrid work environment. And on the right side, you can really see that this is something employees actually have shown preference for. You can see on the results of that survey that shows employees showed an increase in the willingness to work from home post-COVID-19. And employees now essentially are looking forward to work at least 2 or 3 days per week from home post-COVID-19. So that survey essentially asked employees their preferences to work from home pre-COVID-19 and post-COVID-19. And for example, prior COVID-19, 9% of employees wanted to work from home 5 days per week, but that number increased to 16% post-COVID-19. But again, like I mentioned before, probably the greatest delta can be seen on the people that want to work at least 2 and 3 times per week. Combined, about 40% of employees want to work at least 2 and 3 days per week from home. So that's really showing how sticky these behaviors can be and how that can really benefit cloud computing companies. And then it's just one more tailwind that really we see propelling the growth in the cloud computing theme. Right now here, you can see that the left chart is showing expected revenue growth for the cloud computing theme as a whole, and some of the segments that we talked about before. And as we can see here, the total market growth is really going to continue in 2021 and 2022, actually accelerating from 2020. That's really important as we start thinking about the future of cloud computing and how companies can actually benefit. And this is important because traditionally or historically, as we can see on the chart of the right, as revenues grow, there has been a positive correlation with margins or margin expansion. So these companies can really grow revenues and maintain costs fixed, which allowed them to see this margin improvement as you can see here as they tend to scale their operations. So with that, we're gonna shift gears towards the next theme of the day, the Internet of Things also having a huge impact as we think about the reopening economy and in the future about the new normal economy. So again, starting at a very high level, I think for us, IoT refers to the idea that everyday devices can be connected to the internet and be smart. And without getting too deep into that definition, we can see here that many estimates have connected devices reaching about 75 billion by 2025 from just about 20 billion 2 years ago. So that's really showing a 3x growth rate in a period of 6 to 7 years. So again, another theme that it's expected to continue to grow quite rapidly. And this growth is expected to be supported by, number one, rapidly failing cost, and I'm going to talk about that in just a second, but also growing commercial adoption, even outside the industrial segment. Now we see chips, semiconductors, microprocessors in multiple devices from multiple industry, from microwaves to light bulbs, doorbells, to more advanced technologies like robotic surgery, autonomous and electric vehicles, and the list just goes on. But consumers' behaviors are also changing and favoring smart and connected devices. And that's because the cost differential between a smart product and a non-smart product is very, very low and continues to narrow every single year. So that's really making the decision easy for consumers to tilt their behaviors to favor smart and connected devices. And of course, as we think about improving connectivity, the 5G rollout, as it continues around the United States and around the world, it's going to be another tailwind for the Internet of Things. So as we look at these subsegments that we believe could potentially benefit from the proliferation of all of these connected devices, we at GlobalX have identified some subsegments as you can see on the bottom left side of the chart, and that includes, number one, connected IoT products, or the manufacturers that of these IoT devices. Also, we're looking at networking infrastructure and software companies, other companies in the area of equipment, vehicle, and infrastructure building technology, and finally, semiconductor companies or manufacturers that are really working with a chip technology that goes into all of these connected devices. And this is really one of my favorite slides because, as you can see here, the chip on the slide is a Wi-Fi chip that you might find in any number of different household smart devices. That same chip was used in the first iPhone back in 2007. And as you can see there, it cost about $7.40 per unit. Fast forward 13 years, the same chip cost about 10 cents. So that it's almost a 90% decline in cost. And the image below shows a dime compared to the size of these chips. And of course, these images are to scale, but essentially that Wi-Fi chip is 1/10 of the size of a dime. And as you may have guessed, this is essentially Moore's law in action. So now the question is, how all of these tech talk really relates to the reopening economy? And to answer that question, we have put together this table on the right, because since now it's possible to have connectivity in many devices, we have noticed that connected devices are really playing a very important role in the reopening economy, as they're used to measure occupancy, they're used to measure density, take temperature readings, and even in some cases detect early signs of COVID-19, the infection, and in some cases also allowing data to be stored and analyzed in the cloud. So all of our organizations and governments can keep track of this data and try to prevent spreads today and in the future as well by taking immediate action. So as you can see here, these technologies include sensors, include wearables, includes drones, and in some cases even some robotic applications. So let's explore a few of these use cases, because I think it's important to make sure that we can visualize what IoT's role it's going to be in this reopening economy. So if we start with wearables, we need to understand that there is a very large number of physiological metrics currently capable of being measured by a lot of IoT devices, actually commercial wearable sensors. And the power of wearable devices is that any changes in physiological metrics can be read by an early detection algorithm for COVID-19 monitoring. So essentially, in real life, we have programs such as the one from Fitbit last year, where where Fitbit had about 100,000 users across the United States and Canada that sign up to allow the wearable device company to detect and inform users for early symptoms of COVID-19. And the study showed that wearable devices detected nearly 50% of COVID cases at least one day before participants reported symptoms. So imagine how important this is by essentially allowing people and organizations as well to take quick action and identify at-risk communities. Now, if we look at the right side of the chart, we're looking at sensors. We need to realize that despite the fact that many employees may continue to work from home more often, as we talked during the cloud computing theme, for many other employees is simply impossible to change their workplace. If we think about factories, warehouses, frontline workers, remote working is simply not possible, right? So as we think about this in the context of a reopening our economies, we're seeing solutions that combine contact tracing with user level alerts to contain the exposure and empower workers to maintain distance. So in this case, proximity sensors are actually being used and are offering a solution to many companies that simply cannot have their workforce at home. Basically, employees can receive an alert if they have been too close to other employees, and we're seeing this in the factory landscape, in logistics, warehouses being implemented. So this is also helping management teams to better manage employees and employee data about physical proximity and ensure that workers are working under a safe work environment. So it's really powerful what we're seeing here. But it's important to understand that IoT is not simply that sensor or that wearable device that's collecting data 24/7. It's really about the combined power of very inexpensive sensor devices, very inexpensive remote networks, a vast array of cloud storage, and increasingly sophisticated algorithms that can analyze all this data created by wearables and sensors. So now we really have the ability to track correlation of change that let us predict what could happen in the future. So I really think this is really transformational as we reopen our economies. And as a final example, we wanted to show the use of temperature sensors, especially in high throughput areas like businesses, airports, and schools. Clearly in businesses, temperature check kiosks are now the norm. It helps organizations to prevent the disease. Here in our main office in Midtown Manhattan, for example, we have some of these kiosks already in place, and I'm sure many of you can say the same as well. In airports, there are applications that combine temperature information from thermal cameras and also crowd density measurements from LiDAR technology with flight information and passenger flow. And basically, these systems can detect passengers with high temperatures and alert airport operations to control potential contaminated areas. So essentially, they can quickly redirect passenger flows, reposition flights, close infected areas, and relocate staff. And for schools, the situation is similar, as we all know. All in all, countries, large cities, and organizations around the world are already integrating these applications to mitigate the pandemic. And IoT would not only serve to help with the current pandemic, but also is going to help to prevent future outbreaks. Because like Andrew said at the beginning, we have seen a rising number of COVID-19 cases recently. So with that, we'll shift gears towards the genomics, and I'll turn it over to Andrew to go over this theme.
Thank you, Pedro. Genomics is really a theme that has become front and center during the pandemic. We've seen immense resources mobilized to the field, both from a scientific research and development perspective, and also just from a general investment perspective. Despite that, it's a long term that we've had conviction in for a long time. The pandemic accelerated its adoption and transformed it, and reopening is really adding further tailwinds. Many of the solutions to the pandemic that we see on a daily basis take for granted, even diagnostics being one of those, different treatments being other potential areas, really involve genomics. But first, I want to get into the basics of the theme. Genomics is the study of genetic material, DNA, RNA, really what make us, or organisms themselves, and looking at the makeup and ordering of that material, i.e. how the building blocks, also called nucleotides, are ordered. Living things have genomes. Some non-living things, like viruses, also have genomes. We look at this general theme, or this science, in 4 different segments. The first being genomic sequencing. That's determining the exact order of those building blocks or nucleotides to really give a code for the genome. You got computational genomics. That's the next subscience. The idea there is taking the data from genomic sequencing and from other sources to develop insights around that, whether that's around potential treatments, different other services and impacts related to genomes and general interactions with pharmaceuticals and those treatments. Next, you have gene therapies. Those are gene therapies are therapies that are used to modify or assist in the treatment of different conditions based off of interactions with genes. Also, genetic medicine's falling in there. There's a little somewhat of a broader category relating to the actual genetic material. And then you have gene editing, where instead of inserting a gene as you would see in gene therapy, it's actually deleting, editing out, and or replacing portions of the DNA as it relates to the organism in different conditions. Why are we talking about this right now in terms of our conviction in the long term? Well, it's cheaper than it used to be to sequence, significantly cheaper. Looking at this chart here, this is a logarithmic scale, so instead of seeing the exponential line, you're seeing a more linear, but even that said, you are seeing a significant drop in the cost per genome, even with that logarithmic scale, significantly below that of the cost of computing that's typically used for Moore's law. So you're seeing a little bit of the benefit from technological advances, as well as just the benefit from improvements in the science. I think a really telling fact here, 2003, first human genome was fully sequenced. Well, it actually took a decade to get to that, but that cost many billions of dollars. And today we can do that for just under $1,000, even half that. Next, you also see that there is information from that sequencing that can help address previously incurable conditions. We'll get into that in a second. Next, there's increased demand for catered healthcare solutions. Precision medicine or personalized medicine, also words that are thrown around for this idea. It's really about treating people based off of their particular genetic information, something that only improves as you get more and more information around population health as in relation to genomes. And then next, you have more and better data. That's improving R&D processes, not just improving outcomes for patients, but it's helping providers, it's helping pharmaceutical companies in their business operations. So really, holistically, there is the benefits across all the different stakeholders typically involved in healthcare. Next, let's cover the cost improvement on the next slide and the general evolution of sequencing. Looks like we're having a little bit of trouble. Here we go. Perfect. So getting into the cost improvement and evolution of sequencing, it's really about next generation testing, diagnostic sequencing. The old method of genome sequencing, called the Sanger method, slow, very labor intensive, which is a part of the cost. It was you sequence one DNA fragment at a time, or one piece of genetic material at a time, and it really was not that effective at doing a number of different things, including identifying new pathogens. Next generation sequencing, we're going to call it NGS from here on out, is the new school of sequencing and came to be in the early to mid thousands, really ramping up in the mid thousands, with Illumina being one of those big names involved there, also Pacific Biosciences and a number of others. That's really about sequencing the fragments in real time, using modern technology to do so, including the use of software and different devices that are developed for this particular purpose. And that's really to determine the order of the sequence parallelly is what it's called. So many different sequences at a time. That kind of evolution really does parallel with the rise of computing and cheaper computing. This is really important because of what it means for the total addressable market for genomic medicines. By making these developments when it comes to sequencing, it really untaps the different markets across different healthcare areas when it comes to treating different conditions. So we see here, and that actually should say unit billions at the top there. Apologies for that. But across the different areas on the chart on the right, you see that the orange, those are newly addressed areas for conditions that are relative to the different area of treatment, and that they are pretty significant. The orange is popping up, so that in terms of what genomics can unlock there. And then, of course, there's the blue, and that's just enhancements to care that's already being rendered, but using genomic technologies. The bottom there, you can see that the volume of clinical trials really shows that the future landscape is bright. That's increasing, and that's just using the most recent data we could get from NHGI ending in 2018. Certainly increased this year or in 2020 and 2019, and I think really addresses the idea of looking at new conditions. Anecdotally, there are gene therapies right now to treat or in clinical trials to treat genetic blindness. Just an example of something you couldn't address before. Now they're thinking you can with genomics. Next, let's look at the next slide for the COVID-19 relevance. As we try and move slides, I'll get into it. Sequencing was really important for the identification of SARS-CoV-2, the virus behind COVID-19, as a new pathogen. SARS virus in 2003, not the same virus. I think important to make that distinction. Does share some of the genome of that virus, but it took over 70 days, or around 70 days to sequence with the old Sanger sequencing method, which this time around it only took around 10 days based off of the original upload or the original decision to start looking into it as a new pathogen. This is really because of the enhancements to sequencing from next generation sequencing and the costs therein. And then also that the genome for that was then published to the internet, something that wasn't really possible before, which really allows for wide scale surveillance, use of genomic data and differences in data over time and based off of geography to track transmission and the general evolution of the virus. Looking at the map on the right, that's really created using small differences in the virus's genome to see how it's spread. In other words, if someone in one region is infected with a virus that shares the same genetic code as someone from another region, that means there's a higher probability of those being connected. And with the volume of data, you can establish more certainty. So as the little building blocks that I was referring to before start to change as the virus transits, which does involve mutation, but not in the same way that I think is typically discussed, where it sounds like something that's extremely a devastating kind of development. A mutation could just be something very small and insignificant, but does allow for tracking. Next, that genetic information from those original sequences were essential for the first PCR tests. Those are those, I'm sure everyone's familiar at this point, the nasal swab tests that take a little bit more time, but were really the first tool that was used to diagnose COVID-19 at the onset of the pandemic. a number of companies in China really getting on developing those really as soon as that first sequence was done in January 2020. But now we see that over time, the cumulative COVID-19 tests by country increasing drastically as we get into reopening, what we were talking about earlier. And that when it comes to the impacts of this as it relates to genomics, really beneficial for those companies involved in the overall diagnostics chain and those in genomics. Next, we see that the number of genomes uploaded has exponentially increased over the course of the year, really showing how mobilization of resources has allowed for next generation sequencing to expand even more during the pandemic. And also that this data is useful as it can create maps like this, really provide knowledge around surveillance. On the next slide, we're going to talk about development of vaccines and treatments. COVID-19, outside of the diagnostics aspect of this, really mobilized the medical community to collaborate and pool resources in developing different treatment options. On the left, super evident by the range of treatments and vaccines currently in development. Some of them use genomic sequencing as a core tenet. RNA vaccines, DNA vaccines, for example. RNA vaccines being those that we're seeing right now being used in inoculations, the Pfizer BioNTech vaccine, as well as the Moderna vaccine. But then there are also DNA vaccines in development right now in clinical trials. Those other two vaccines are as well. They're just seeing earlier rollout in certain areas. Other treatments use genomics-derived information about proteins, virus-host interactions, trying to limit the spread of the infection or stop the infection to begin with. That's more on the treatment side. People may hear about antibody treatments, antiviral treatments that stop viral infection and replication within the body. On the right, we then see the pure scale of the vaccine development and rollout when it comes to the publicly disclosed vaccine deals by region. This is not every vaccine that's been arranged for what the general capacity is. These are just the disclosed deals between countries, regions, and the different vaccines that are out there, including those that are still under review. But on the right, those are the vaccines that were being administered in some parts of the world as of January 13th, a little over a week ago. And then the under review bar, you can see that as well. It's just massive amounts of capital being directed for these purposes, and also really scaling what the general environment for this in a way that's really important. I think a good example, last week we saw that there was some positive data around using mRNA platforms that were used for the COVID-19 vaccine now being applied to treating diseases like MS. So that's a really important development, showing how this isn't just a one-trick pony. This is something that's going to continue moving forward. Next, going to the next slide, we're going to talk about telemedicine and digital health. This is going to be the final theme we cover today. It's been top of mind for many investors during the pandemic, with individuals staying at home, relying on virtual healthcare for doctor's visits, getting information on their health, and for healthcare providers to continue doing their job. We identify 4 different segments within this theme, telemedicine and digital health being the overarching theme. The different segments here being telemedicine, just the provision of of healthcare through digital means or wireless connectivity. Next, you see connected healthcare devices and healthcare analytics. Those are 2 different segments there related to the data. I'm sorry, I think we're getting some pop-ups on the screen there. Apologies for that. Connected devices and healthcare analytics, which are 2 different segments that are related to this. Connected devices being those that monitor conditions, provide data for those different conditions. Also healthcare analytics, processing that data using artificial intelligence to make use of it and for other purposes besides that. And then administrative digitization, which is the taking healthcare records, putting them up into digital mediums, and then also using them for different insights around improving business operations. Digital transformation in healthcare has also been a long time coming. Different drivers that we see there There are addressable conditions and healthcare disparities that need to be addressed. You see 15.6 million excess deaths occurring in low and middle income countries a year, which is definitely something that can be avoided through some of these transformations that we're going to dig into. Next, you see current and future longevity. Populations are getting older, both because of expanding lifespans, but also because of decreasing cohorts or population when it comes to younger generations. Just there are fewer younger people in relation to older folks. Older individuals tend to need more health care, and this is a pain point that can be addressed by this type of transformation. And then finally, there's this on this side, there's the inefficient healthcare systems aspect of this, where all of these technologies can really enhance healthcare systems and improve things for all stakeholders across the value chain. We also see the technological gaps and capabilities, gap narrowing, capabilities increasing as healthcare systems can make better use of data based off of expanded capabilities and greater internet access across the world. Moving to the next slide, please. Telemedicine digital health really brings, in terms of addressing the disparities there, it can bring healthcare to those who may not have geographic access to it. As you can see by the chart on the left, the disparity is quite large, looking at the average hospital bed density per 10K population, as well as physician density per 1K across these different GDP per capita buckets. It's quite clear that the healthcare resources are far lower for the low GDP per capita bucket compared to the high and mid-range buckets there. And that's definitely a pain point that needs to be addressed, and something that we've also seen as valuable and useful during the pandemic, where we have electronic remote intensive care units with connected devices ranging from ventilators and monitoring systems that track vitals, oxygen levels, heart rate, other types of data from afar, and proving very useful. Even before that, we've seen use of this type of technology in remote areas to positive effect. Next, we see that it's very, very evident right now that proper health care is really afforded to those in the higher income areas, or just with greater income in general. 100 million people go into poverty every single year due to healthcare expenses. Telemedicine and digital health are a more affordable option in the long term and short term, offering cheaper care, less follow-ups, travel savings as well, not going from A to B. But also you see payers are embracing them just based off of some of these different benefits that we're seeing. Moving to the next slide, please. These charts really show the adoption of this in action. On the left, we can see the orange bars and the blue bars, orange bars representing 2019, blue 2020. And this chart looking at the share of overall insurance claim lines and where telehealth stands there. Before or in 2019, well below 1%, and really seeing that because of the pandemic, due to the pandemic and the stay-at-home orders, you saw drastic adoption at the very beginning. A little bit of definitely a drop off as the introductory months of the pandemic kind of passed, but then also that because that infrastructure was in place, and also the general idea and policies needed for telemedicine digital health were being embraced, that we're starting to see that plateau there. That data ends in October, somewhat of a lag when it comes to the reporting there. But we expect this to continue to plateau, if not rise, and then generally rise and make up a significant share moving forward as we move toward a more outcome value-based healthcare model. Also, with all this digitization, you see a lot more healthcare data, and with better and more data, technology like AI can use it to automate or improve processes. The library of FDA-approved AI algorithms has continued to grow over the past 4 to 5 years, really spiking in 2020. And this is only September of 2020. You see a steeper slope between 2019 and 2020, it being a cumulative chart. but really reflecting that increase in importance of these types of technologies for healthcare. And then also looking at the different breakdown of those algorithms, that they are treating diverse areas, and that many of them actually do relate to COVID-19 and improve overall outcomes by improving the actual accuracy, but also by taking stress off the healthcare system. Moving to the next slide, please. We've also seen the transformative power of all this tech in healthcare come to light during the pandemic. Telemedicine and remote monitoring, that means more resilient systems. You aren't bringing patients in unnecessarily and risking the spread of the virus. And hospitals can focus on the things that they really need to for those in-person treatments that are necessary. It also means more efficiency. Technology can be used to triage patients automatically, helping get infected or afflicted individuals the care that they need without human interaction. And it can help allocate resources when systems are strained. This means putting doctors in places where they're needed and tracking assets vital to treatment, like ventilators, which actually was very important during the pandemic, based off of the stresses on the healthcare system and the volumes that were being seen, especially in the spring in the Northeast, that doctors equipped with Internet of Things type of technology that Pedro was referring to earlier were able to be allocated and paged based off of different areas in the hospital that needed them. And then also with all the ventilators moving around, that those were assets that they could keep track of. All this tech also means greater efficacy. You have data that can help fine-tune treatments for patients, the idea of precision, personalized medicine that we were referring to before. And then also there's this interoperability, and this means that data being more easily shared between providers, from patients to providers, providers in countries, payers as well, pharmaceutical companies, really helping them to get a knowledge about the state of public health and individual patients too, and helping them make public health and budgeting decisions. I think also final point is the benefit that this will and is offering pharmaceutical companies by having access to connected devices that are monitoring patient health, and also having insight into from the genomic point of view what conditions people face and how different treatments interact with different genetic profiles. It's a lot less like throwing a handful of darts with a blindfold on at a dartboard and hoping to find a viable drug. It's really using this data and information to make informed decisions, make clinical trials more effective and efficient, and hopefully discover those treatments that we really think are going to bring us to that expected total addressable market for all of these different themes that we were talking about before. So I think that is now the conclusion of our presentation. Some of the key takeaways here, that we really saw a lot of these structural changes accelerate during the pandemic, that right now there's a big focus on flexibility and safety, and that's one thing that's driving many of these trends, and that because of the flexibility and safety required and some of the lessons learned, as well as the way that consumers have embraced these technologies and consumption styles, that we're going to see stickiness here. And then in terms of how economies and everything have transformed, that these different themes and these different technologies and developments that are relevant to them have really just become a part of our everyday life, of our economies and of our businesses. So that is the conclusion of the presentation. Now here's a little look at some of our research. You can find our research on globalxetfs.com/research. Also follow any of us on Twitter, where we post daily insights. And then we have, I believe, a disclosure slide that we need to keep on the screen. Perfect.
Great. Andrew, Pedro, thank you so much for this interesting and really incredibly relevant presentation. I don't think we're going to have time to get to any of the questions, but I have been told that we will follow up with you afterwards. Also, as a reminder, we are recording this, so you can find it and share it if you want. Go to Interactive Brokers website, Across the top, there's an education tab, select webinars and previously recorded webinars. And you will be able to find this. It'll be up later this afternoon. So thank you all for participating.
And also, Alison, on the GoToWebinar control panel, there is a handouts area, and today's PDF from GlobalX is available for immediate download.
Perfect. Okay, I think that concludes everything. Thank you so much for everybody for participating.